Hello, everyone. Thank you so much for joining us. This is JAA Your Way, and I am Jennifer Airy, Special Needs Navigator for the Jewish Federation of Southern New Jersey. And I'm here today with our guests from Bancroft. I'm sure all of you have heard of Bancroft here in South Jersey. And I'm so excited to be speaking with you today. I have Dr. Lisa Alberts. She is a Doctor of Advanced Practice Nursing and is a Senior Clinical Director for Children's Health Services. And then I have Dr. Tracy Kettering. She's a doctoral level board certified behavior analyst, and it has a PhD in special education. Wow, that's some very impressive titles. I'm sorry if I mangled them a little bit. It's very exciting to have you here today. So can you tell me a little bit about your backgrounds and what drew you to special needs, working with special needs populations?
Sure. Thanks, Jen. We really appreciate you inviting us, and it's really nice to be here with you.
Thank you.
I've been in the field, practicing in the field of special needs and treating children and adults with special needs for probably over 30 years as a nurse. And I just, love what I do, and really enjoy treating children and adults, and really happy to be here.
Oh, fantastic. And how about you, Tracy?
I sort of entered the field and became involved with this population through behavior analysis. So I started taking coursework and training in psychology and behavior analysis, and fell in love with that science, and then saw what that science could do for this population in particular, and that's sort of what drew me, pulled those together.
Fantastic. Well, I am super excited about our topic today, which is puberty. And for many of our children with autism, this can be a really challenging time for them. And so I'm excited to see if we can give our families some better understanding about what's actually going on inside of our children's bodies, and sort of how some strategies on how we might be able to help them, because that's so important. So I think a good place to start is actually with what does puberty and adolescence mean? Because my understanding is those are actually two separate things, and I think most people actually think they're one and the same. So can you tell me a little bit about that?
Sure. Puberty is a concern for all children and families, and what we hear from our families is really apprehension and sometimes fear, because they don't know what to expect when their child is entering puberty. So puberty technically is the hormonal changes and physical changes that occur in girls between the ages of 7 to 13 and boys between the ages of 9 to 15 on average. And those hormonal changes are stimulated by estrogen production for girls and testosterone production for boys. Leads to those physical changes that we see in puberty. So it's a very challenging time due to those hormonal differences. But that's the truth for all children, not just children with autism, but also neurotypical children. We see those changes. Adolescence is really that period of time where social, emotional, and behavioral development occurs in children. And the challenge is for individuals with autism and intellectual developmental disabilities, those social and emotional developments occur perhaps later, late teens and early 20s. So that's really the difference in adolescence between children with special needs and children that are neurotypical.
Well, and adolescence is something that all children experience, and can produce anxiety and changes that, moodiness, distractibility, things that all parents experience, not just children with autism.
Now, I have two boys. My oldest is 16, my youngest is 14. So I'm kind of familiar with the roller coaster ride some of our families are going through and may experience. But can you tell us a little bit more about how puberty and adolescence differs with our children who are on the spectrum versus, say, their neurotypical peers?
So the short answer is mostly it doesn't differ significantly. The changes that we see hormonally are the same for children that are neurotypical and children who have autism. Adolescence, as I mentioned just a second ago, can occur later. And for children with autism and children without autism, you still have moodiness, irritability, and tiredness. But the challenge is really with communication deficits that can impact their understanding and the family's understanding and preparation of the whole process.
Yeah, and research on this area is really scarce. So, we hear from families and clinicians that often experience something during this time period, but it's unclear if it's just sort of the natural progression of any individual, or if it's related to sort of those changes in their body in puberty and adolescence. But I think that there's nothing to suggest that that this time actually produces or changes the person and might cause problem behaviors, for example. But naturally during this time, there's other things going on. Kids get bigger, right? So kids get bigger, and their behaviors may become more unmanageable because of just sheer size. It might have nothing to do with really what's changing, but really just their actual size. And I think that that many parents shouldn't expect that, like, oh, my child that has never had any behavioral concerns, they're automatically just going to happen right now. Although that's definitely a possibility. What's more likely to happen is that the children that already have some level of problem behavior, which is often related to lower communication skills. You might see increases in those behaviors around this time in response to things that are happening, right? So, a child that has always had difficulty communicating when something is uncomfortable or painful or something that they don't like, you might see similar responses to changes in their body, right? So those changes might cause new things that the child reacts to, rather than those behaviors being caused by the changes themselves.
And they have difficulties communicating that. So the challenge is to for parents, is to be tuned into, this period of time where new challenges may emerge, and then be able to traverse that.
That makes sense. So if you have a child who maybe in the past was prone to maybe having meltdowns and having communication challenges, and through therapy and through intervention gained some skills, but now is experiencing brand new challenges that they just don't have the words for and can't articulate, you might see those behaviors come up again.
Exactly.
Okay, that makes sense. So I think we kind of covered what's different and what's the same, but just hearing other parents talk about their own experiences and knowing my personal experiences with my sons going through puberty, these stories can be really, kind of heartbreaking and sometimes even alarming. Is there anything that you would want to say to these families to kind of, is there some hope for them? Is there, will this get better? What are some of the things that we could tell those folks that might be experiencing this right now?
Well, everyone gets through puberty. It will pass. There may be some challenges along the road for all families, but everyone does get through. We can anticipate that, in girls, for instance, once those secondary sex characteristics develop, breasts, for instance, we know that 12 to 18 months later, they're going to start their period. So we can anticipate that, and we can give parents some ideas and tools to manage that ahead of time so that they're prepared.
But I think just to back up a little bit before, I think what you're asking about is the problem behaviors or challenging behaviors that parents report sort of happen during this time and what to do about them. And I think that, the answer is that you would do the same thing if your child experienced problem behavior during puberty as if they did when they were 5. And that would be to look for resources to help you to manage those. And are, the evidence-based practices for decreasing challenging behavior in this population are medication management or applied behavior analysis and behavioral intervention. And so, knowing those two things and using resources on science of how to treat challenging behaviors in this population will ultimately be your best route to success is not to sort of abandon those things that we know actually treat this just because it's happening at a different time in their life.
Okay, so ABA therapy or applied behavior analysis that you may have used when your child was little can still work as they get older.
Absolutely.
Yeah, so anytime that a person is engaging in problem behaviors, and that might be aggressive behaviors towards others, disruptive behaviors towards their environment, or self-injurious behaviors towards themselves, the goal is to find out why those behaviors are happening. They're all usually tied to some environmental events, so things that happen before and after the behavior, and then assessment can identify what those things are, even if there's an underlying biologic change that might make those things more likely. So going through puberty might make those behaviors more likely. It's still likely that the current environment helps to shape and make those behaviors happen and continue to happen. And assessment can identify what those things are and help you to change behavior in that context.
Here's an example maybe that might make a little sense. So your daughter is menstruating, and you feel that every month behaviors go up significantly. So you use the process of applied behavior analysis in tracking those behaviors, and you can see that 2 weeks before the menstrual cycle begins is when the behaviors skyrocket. So you can take that information to your provider and say, this is the pattern that we've identified. There are conditions that are associated with hormonal dysregulation, premenstrual dysphoric disorder, for instance, that occur 2 weeks prior to the onset of menses. So you can identify that if that's the pattern, then that can be treated somewhat differently. So the use of applied behavior analysis in looking at even these underlying medical issues is really, really valuable.
And you can't just assume, though, that every child will be the same, right? So in that same example, you might have an individual that has behaviors at a certain point in the month, maybe related to that sort of underlying pain or discomfort, but they only have those behaviors when you tell them to go do something that they don't want to do, or engage in exercise, going on walks. So it might not be just that it's, the pain causes them to have some kind of challenging behavior, but more that those behaviors change how they respond to something else happening. And so, teaching someone how to say that they don't want to take a walk, or that they don't want to engage in exercise, or to choose what they do can be, a way for them to gain skills and reduce the likelihood that they'll have challenging behaviors under those situations. So it's still, you mentioned earlier, every child with autism is different, and those same things that could happen in 5 different kids could be caused by 5 different things.
Absolutely. That really makes sense. And I'm curious to know, are there things that families can do to help prepare their children? Are there skills or things that we can work on developing? Say maybe your child's 8, 10 years old, and you know puberty's coming. It's those birthdays every year, they keep coming around. And are there things that families can work on to help make this process a little easier, a little smoother?
Yeah. So first, there's lots of assessments actually that people in your care team can perform to identify what those skills that they have are and what skills that they still need are, that will let you know. Does a child with does a female have the skills necessarily to toilet themselves, but also to change their personal hygiene materials during their menstruation, or for a boy that might be developing hair, has he learned how to shave? So there's lots of assessments that really go through skills for you, so you don't have to just guess what things that they need to do. One is the assessment for functional living skills. It's called the AFLs. There's another called Essentials for Living. But any BCBA or even maybe a teacher in your special education classroom should be able to sort of point you in the right direction to help you figure out what those things are and help you to develop a plan for teaching them. There's other skills that aren't necessarily sort of personal skills, but things you have to learn as you get older. Boundaries and personal space, safety, things that will increase the likelihood that, a child that's going through this stage in life will, be safe and have all the skills they need to navigate not just themselves, but their environment. Other things might include, teaching a female or a male when it's appropriate to touch themselves, or the difference between doing things in private versus public, touching other people, things like that can be really important at this age.
Fantastic. Now, you mentioned that BCBAs and their behavior therapists can be very helpful during this process. Is this something that also maybe talking to your child's study team at school could be helpful?
Absolutely.
The whole care team, it could be the primary care provider, the school team, the behavioral team, really can work together to come up with a good plan.
Some people receive most of their services in the school setting, and if that's the case, then your school really should be helping you to make sure that their needs are being met, right? And then other individuals receive additional supplementary services, maybe in their home or in the community, and these things can all be targets for those environments as well. So it really depends on the resources that you have, but all members of your team are going to be your sort of biggest resource, your social worker, to help you navigate and figure out how to get these questions answered and how to get the assessments completed and the goals selected for your individual to learn some of these things that are going to be really important.
Absolutely. It seems like communication is really the key part to this whole process, because that's the theme that I'm hearing from you, is really talking to other people, letting them know your concerns, and then working together to figure out a solution to those problems is all, the main piece to that whole process. And I know that social taboos can sometimes be a hindrance to that process. And is there anything that we can say to families who might be concerned or uncomfortable with talking to their child about menstruation or sexuality and things like that? And then also talking to other adults, talking to your child's teacher. That can be a difficult and challenging conversation to have. And do you have any recommendations there?
Well, I think we're going to talk a little later about some of those specific tools that parents can use that are available for parents to access, regarding making those communications. But really involving, too, I think the healthcare team, the primary care provider, or the gynecologist, and having a plan in place. Because sometimes those people can really communicate with the individual, too, depending on, the cognitive level, and they can be helpful in sort of traversing some of those issues. Mm-hmm.
But I think any hesitancy that any parent has, these are difficult things to talk about. They're difficult things to talk to other people about, let alone
for anybody.
For anybody. I think even clinicians sometimes get shy in saying talking about some of these things openly. But as a parent, a lot of times you're serving as an advocate for your child, and knowing what they need and what they need to access, becomes sort of part of your job, right? And I think every parent serves an advocacy role for their child, regardless of whether they have special needs or not. It just changes a little bit when your child has autism.
I know I've been told by other professionals that it's really important to make sure you're using appropriate terminology when you're talking about body parts and body functions. So that way, when your child is talking to another person, maybe their teacher or they're talking to their doctor, that everybody understands what everybody's talking about. Because very often we have like cutesy names for body parts and things like that. And they can mean, those cutesy names can mean different things to different families. And it makes communication very difficult. But
That's absolutely correct. Using anatomical terms really improves communication. Everybody knows what you're talking about, rather than creating names that other people might not understand.
Definitely. Now, are there any other changes that we can expect that we really haven't covered yet for our children with autism going through puberty?
30% approximately of children with autism will develop epilepsy in their lifetime. And we know that seizures can occur during times of stress, during hormonal changes, during illness. So that's something to really keep on the radar and sort of monitor for the emergence of epilepsy or seizures during those hormonal changes of puberty.
Okay. And now for everybody who's watching, can you tell us a little bit what that might look like? What are some of the signs that parents should be alert for?
Yeah, and it really varies. It's really how the brain's put together and wired up. So it's different for every person. There are different types of seizures to look for. Some of them can be very subtle. Your teachers may be the first people that identify that there are lapses in attention, that an individual seems to be staring through you and not at you. There are, other than having a tonic-clonic seizure, which is obvious for everybody, there are certain types of subtle neurological changes that are difficult to see. So I would keep lines of communication open with the healthcare team and with the teachers.
Excellent. Now, for many of our children who have autism, mine included, they're typically on some sort of medication for various reasons. Can you tell us a little bit about those medications when they're going through puberty? Are there any changes or things that we should know about?
So a lot of children with autism are prescribed medications for behavior as a young child.
Or epilepsy, right?
Or epilepsy,
Yep.
Absolutely, and mood. So, the antipsychotic class of medication are frequently used. Two medications that are approved for children with autism for irritability are Abilify and Risperdal. And most of the medications in that class increase a hormone called prolactin, which is a hormone and can affect the production of other hormones. So in males, it may suppress the production of testosterone. And increases in prolactin can cause breast growth or gynecomastia, and in very rare cases, milk production. So if your child is on those medications, monitoring for those side effects is really important. And as medication dosages are adjusted during this period, you may see changes in that presentation, that behavioral presentation, as that happens. There are medications that stunt growth, so they prevent the pituitary from really working the way they should. ADHD meds are known to do that, and also some antidepressants can do that as well. So again, if growth is not being achieved and they're on those types of medications, then it's important to talk with your healthcare provider about that.
Definitely. I know with ADHD medications and stimulants to treat that, it's important to watch weight gain, because so often with our children on those medications, their appetites are suppressed.
Yes.
And we need to make sure that they're staying healthy.
And maintaining those healthy behaviors during this period of time is really, really important. So hygiene, toothbrushing, really not forgetting about the basics as you meet these other challenges.
And especially, learning how to use deodorant and, taking care of those basic needs are so important. And and a common problem for all teenagers, whether they have autism or not.
That's right.
Now, what should I start with as a parent? And my child has autism and is going to be going through puberty, sometime in the near future. How can I personally prepare for that stage in my child's life? Are there things that I should be doing now?
Have a plan.
Yeah.
Be prepared, do your homework, talk to people on your team, figure out, one, who your resources are that can help you to navigate these times, and that might differ for each person that has a child with autism, depending on the services that they have access to. But those team members are really going to help to get you through the assessment of skills that need to be taught, the management of medications that might be necessary.
Parents know their children the best. So you probably can anticipate what skill deficits there may be. Mm-hmm. So understanding and how to communicate that to the team, healthcare team, educational team, behavioral team is important. So don't be afraid to tell people what you know as a parent, because you're the expert on your child.
Absolutely. Now, are there resources? We hit upon this a little bit earlier, right. But I just wanted to see if there were any resources for that planning stage, or any stage really that our families that you can use that you would be willing to share with us.
So the Autism Treatment Network, or ATN, which is supported by Autism Speaks, has a toolkit available for families, and it really talks about how to communicate difficult issues during puberty and adolescence to the whole team. That's a great resource for families.
Yeah, it's a resource that really steps you through all changes that happen at that age, not just necessarily related to puberty and adolescence, mm-hmm. but just things in even preparing for adulthood, and some things that we didn't really talk about, but other safe behavior things. The water safety and learning how to swim,
wearing your seatbelt.
Yeah, things that we sometimes forget about when we're so focused on specific things that are related to the puberty and adolescence.
That sounds like a great resource, and I'll make sure that that is in our resource directory on the Jewish Abilities Alliance website. Now, is there anything else that you would like to add to that we maybe haven't covered?
One thing that we didn't hit upon is just that it may or may not be related to puberty and changes that occur during puberty, but this is also the time that mental health issues will emerge, both in the regular population and in children with autism. So, always being aware of the things that your child is doing and taking note of changes, looking for changes in their mental health, their anxiety, depression, things like that, their mood, because this is really the time that if mental health concerns are going to develop, this is sort of a prime time for that to happen.
Now, both of my boys were actually diagnosed late. I know the average age for diagnosing autism happens, very early, 2, 3, 4 years old, and both of my boys were, past the age of 10. So I definitely see what you're talking about with these things emerge, these behaviors emerge. But so often our children struggle with that communication piece, and maybe they can't tell us what they're feeling inside, and maybe our child is depressed and they just can't communicate that. So what are some of the things that we should look for that might be going on that could be a mental health concern or a secondary diagnosis that our children just aren't able to communicate to us?
I think first and foremost, you just look for things that are different, right? So any time that a person, any person's behavior changes in a significant way, that's a prime thing that indicates you should talk to someone. And I don't know, specific things, Lisa, if you have.
Well, changes might be affect changes, so how the individual appears. Sad, crying, more irritable than normal. I mean, we talked about that being a normal part of puberty, but to some degree, it's also symptoms of, a more significant depressive disorder that may emerge also during this time. So the degree is something to look for, and concern that the parent has really should be addressed, quickly with your providers to assess for those things.
Changes in sleep might
sleep,
also be
appetite.
Mm-hmm.
Sleep, appetite,
Loss of interest in things that
interest in
they're
things.
usually enjoying to do.
That's right. That's right. And I think really it's important to remember that children with autism and other intellectual and developmental disabilities can and will develop depression, anxiety, obsessive compulsive disorder, schizophrenia. Sometimes what you're seeing is not just attributable to their underlying condition, autism, but it may be something more significant. So understanding that, all children can develop those things, you need to keep that in mind and not just chalk it up to,
And these things do happen much more at a much higher rate in individuals with autism. So approximately 70% of children with autism have some kind of comorbid condition, and 40% have two or more. So, the most likely candidates are obsessive compulsive disorder, anxiety disorders, and ADHD, along with epilepsy, but also some medical conditions like bowel disorders and sleep disturbances.
Thyroid disorder. Mm-hmm.
So really just paying attention to your child, looking at their daily behavior and seeing and noticing those changes, and again having those clear lines of communication with their school and with their providers is key.
Your primary care physician is just as important too as your school team, I think.
Yeah, definitely. It's been a fascinating conversation. I really appreciate you coming in and talking to us about that. I think so many of our families are really, have a lot of questions, are very concerned about this time in their child's lives. And I'm just so thrilled that we've been able to bring this information to our audience. So thank you so much for joining me today.
Thank you for having us.
Thanks for having us.
Thank you so much.